It's Jonathan.
Hi, it's Jana.
Time for Cats and
the
Case. Jana, how's things?
Yeah, good.
All right.
Yeah, good. Yeah, how are you?
I'm all right. Yeah. However, bad news. I've had to break some bad news, and it's something, when you have to, someone dies, or you have to give someone a diagnosis, or tell them the diagnosis you just made. The delivery of the bad news can be challenging. And I thought we could talk about tips and tricks.
Yeah.
How do you break bad news? What works? And how you do it? Because it's something we do a lot of. Something we don't enjoy doing.
Yeah, we don't enjoy it, but it's part of the job. And I think we're actually in a privileged position to be, there for people in those horrible moments.
Yeah.
And so I think you have a very small opportunity to make it a little bit less crappy.
Yeah, and
with your communication.
What they say is people remember, because it's such a big moment in their lives, they remember it like their whole life.
Yes, and they'll remember you.
Yeah, that interaction you have with the family. Not to put the pressure on, but that's kind of what it is. So if you do it well, it can really help in such an awful time. So what's your approach? You've got to, you're outside the room, family are in there. What do you do?
And the thing, well, I should say, I'm not an expert, and I don't think you can ever be an expert at this sort of thing, and I'm still learning new things about how to do this, and I try and do it as well as I can. The thing you have to remember, number one, is everybody has a different response to grief and bad news. So you can't go in there expecting to have a certain reaction, or you can't really go in there and be prepared. All you can do is go in there and be your genuine self and show genuine remorse and care for the patient.
I think that's
and their
the
family.
thing. I agree. Yeah. You could rehearse it, but actually just get in there and give it a go and be genuine. Yeah. You might, fumble your words a bit, but I think that's the way to do it. Are there some things that work well though?
So number one, I think, so I used to work often at the Women's Hospital, and we have to quite sadly give bad news about failed pregnancies and pregnancy loss. And one of the things I liked about working there is I didn't have a phone in my pocket like we do here.
Yes.
And so now I'm mindful to hand off my phone to someone else.
Yes.
So the last thing you want is to be interrupted in the middle of this very important conversation.
And tell your buddies that you're going into it.
Yes.
I'm going to be a certain amount of time.
Yeah.
Can you hold my phone? You'll know when I'm done because I'll get my phone back. And it'll take as long as it takes.
Yes.
Yeah, great tip.
And then the next thing I do is just go in there and sit down and make sure you're, not standing up looking over them. You're sitting down, and then you take the time to do the introductions, introduce yourself and your role, and then find out who's in the room and who they are to the person that you're caring for.
Yeah, really important.
I think that's really important, because you don't want to be giving the bad news to the wrong people. And by the wrong people, I mean you don't want to have to be in the middle of something and then realize that actually their life partner has just arrived you've inadvertently broken all these people in the room, and then they've found out in the most unfortunate way.
It's very tricky. Yeah. So I often do that. I pause and I really make sure I pay attention to who I'm meeting and who I'm being introduced to, and I'm trying to remember the names so that I can actually use that. And I actually focus to do that, because it's a time to focus, because it's so good if you can use the name and you're this person, you're this person, you're the next of kin, you're the key person. So that's a key.
My husband is terrible at remembering people's names.
I think it happens with men. Yes.
And so
have to concentrate.
I have a tip for that. If you hear someone's name and you ask them for their name, just repeat it. And I think if you repeat the name 3 times in the subsequent minutes, you'll remember that name. So I just repeat the name, and then hopefully that
I think
will
it's a conscious effort.
Yeah.
Because often you don't attend to it. You go, because you've got the thing to deliver. Yeah. And you're kind of talking to the people, but yes, get the name, get the name, and you can even write it down, or you can even write your name down, which is another thing you can do, because afterwards the family who you've broken the news to may not remember your name and who was the doctor, and you can give them your name.
Yeah, that's a good tip.
So they know, it's Dr. Jonathan, and he was just been in here for half an hour talking to us about what happened. Can I call him again about something? I have another question. So that's useful too.
Sounds good.
So introductions, phones away.
And then I think then comes the nuanced bit, I think, because classically they say to gather information and, you know, see what they know already and say, okay, you know, Jonathan, what can you tell me what you already know?
Yeah, I don't know.
Now,
I mean, you know,
some people
taken away in the ambulance and that was it.
Exactly. Yeah. But you know, there's some people who will be okay. I'll tell you everything that I know, and now just give me what I want to know. And then there's some other people who just want it given to them straight. They know it's bad. Maybe they've got a medical background. Maybe they saw quite a lot at the scene.
Yes.
And they have some sort of idea, and that's the really hard part. How do you tell those two groups of people? There's no right answer, but you just have to try and gauge. And if you're feeling like they're getting frustrated with you, just be honest and be direct and don't beat around the bush.
Yes. So you got to read the room a bit.
Give them the bullet.
Yeah. Give them the bullet. Tell them what happened, and then
what do you do?
Deliver. I tend to, because I think they know. I mean, the whole thing is you've sat them down in the room.
Yeah, exactly.
You know, it's a basic setup. It's bad news. Yeah. It's not like fun chat around the bedside. I'll be back in half an hour. No, it's very serious. So they know already. Yeah. So usually it's, I'm sure you are aware things are bad, and actually it's really bad, and here's the news. So that's something I might say in words like that. So I break the news. What do you do after that?
So that then comes the really hard part, because I don't think giving the news is the hard part. It's how you deal with the bit afterwards. So we're talking a bit about, you know, a trauma and you sat them down in the room, but I'm also thinking about the patients who, you know, have, you know, cancer recurrence. How many times have we seen that where we have someone who's recovered from cancer, had been in remission, and they've presented with this horrendous, you know, episode of pain, and we've done a scan, and it's, you know, it's the worst possible news for them.
Because they've been through it before often,
they know what it
recurrence.
Means, and they know what that means. So those are the ones that I find very challenging. So once I've given the news, you know, give it in the most direct way possible, with all the information that you know, then you just have to sit there. Then you just have to sit there and be uncomfortable with that. And it doesn't feel comfortable because you're there witnessing this person's, you know, most raw grief reaction. And your instinct will be to, you know, leave them to it, or you know, leave them with their family. And I don't know that that's the right thing to do all the time. Maybe it is for some situations, but actually I think that's
a really powerful bit. If you sit there and just be a presence, even if you don't say anything, you are actually being the best doctor you can be, because that's your job, is to sit there and just help. And often helping is just standing there doing nothing, right? Because that's what you're doing. But you're just giving them time, and they will ask you.
Yes, so they will ask you. And so what I tell my my trainees is, once you've delivered the bad news, it might be really, really difficult, but try to not say anything until they've said something, however long that is.
Because then you can also gauge their understanding as well. So then you can take the story up from what their understanding is. Because sometimes you deliver the news and people are like, what? So, but it's not cancer though, is it? You know, so you know, there's that denial thing. So you gauge it by their response, and you just have to have that pause, and that's another built-in kind of thing, I think, to concentrate. The name, make sure you do the pause, the time, the silence, let them process.
Yeah, let them process. And it is, I just describe it as uncomfortable, because I think you have that, you know, I don't like this situation because I'm witnessing this very private moment of grief. But actually you're there as a support for them, because you're going to help them through the next steps. And while you might not know all the answers to their questions, you're going to be there and you're going to listen to them and say, I don't know, but I'm going to find out.
That's really key, isn't it? Because there's questions you won't know the answers to, but and they will continue to come up. But I'm going to find out for you, or I don't know that, but I know who will know, or here is the person who can help, or here is the solution for you. So you don't leave them up in the air.
I had this one case, I'll never forget it, of a patient who had recurrence, and I sat there with him and his wife, and they just hugged and cried, and I just sat there, and it felt wrong to leave, and it felt also like a very private moment. And then I just said, I'm so sorry. And he just said to me, I'm sorry for you that you have to do this. And in that moment I was like, well, you know, what a job we have to be able to do that. But to do it well almost gives you a sense of like,
I think so. It's a really satisfying thing. It's a funny thing to say, but it's a satisfying thing.
Yeah.
So a bad thing can turn into something very positive. But I guess my advice would be, don't beat yourself up if it doesn't go so well. You might fumble your words or say the wrong thing. It's not the end of the world. Probably be genuine, and you can be upset too. Because I'm often upset because I've just been there resuscitating the person.
What do you think about showing emotion in those
Well,
moments?
I think it's okay. Yeah, I think it's okay.
Yeah. I used to think that it would be taking away from someone's experience or taking away from their grief, but some of the horrific, tragically sad things we see downstairs, I think it's a human reaction, and I think if you are a little bit sad, I think that's okay, and don't beat yourself up if you.
I think people look at you like a genuine, caring person if they go, the doctors, they did all they can, all they could. They were actually really in there doing it. They weren't cold, they were actually trying to save them or do the best job they can, and they will remember that too. Yeah.
And what do you think about physical touch?
I don't think there's anything wrong with that. I think it's okay if it's appropriate.
It's a hard one because I think it depends on the situation, and you don't want to be unprofessional, but also if you're delivering bad news to somebody, they're lying in bed, they're by themselves.
I do that. I think it's just part of it.
I think it's okay to hold their hand.
Yeah, it's part of it. It's part of it, and touch is so important because words are a bit hollow and touch really means something.
Yeah.
So
and we're all human.
So do that. Yeah, I do that.
Yeah.
All right, Jana.
That was a good chat.
Yeah. Anything else? When you leave the room, what do you do?
So when I leave the room, I think I usually, it depends on the situation, but you want to have a plan where you're going to tell them what the next steps are. So the next steps, whether it be, investigations or admission, or you're going to take them to see the patient, for example, and then prepare them for that. So give them, and like I said before, you don't always have the answers, but you can give them some hope or some sort of positive statement, like I don't know how this is going to affect you, but I will find out, or I will make sure that I get X, Y, and Z to come and see you.
I will keep looking after you and your family. That's kind of what you're trying to say, and that's what you're saying. And then self-care afterwards.
Well, we're looking at it. We'll go have a cup of tea and have a chat about it.
Talk about it.
Yeah. Some of these ones hit really close to home. I think
so.
It's normal, and it's actually good to feel a bit sad.
Yeah, no, you should. I mean, it happens. It's part of life.
And you can show your empathy.
Yep. All right, well, thanks for the chat, Jana.
No worries.
Lots of good points there. And so we'll see you next time on Cut the Case. Bye.